Hi everyone, and welcome to another Facebook Live event by Footwork Podiatric Laboratory. Well, let's get started on first MCPJ pain. So your first metatarsophalangeal joint is your big toe joint. A lot of people tend to know it as the bunion joint in the foot. And there are several factors that will cause pain in that joint. What we'll look at today are the mechanical factors. There's factors such as gout or osteoarthritis, arthritic changes, which will also cause pain. But what we'll look at today is how we can help it if the mechanics of the foot are poor. So the way we understand foot function is when a foot overpronates or rolls inwards. As the foot pronates or rolls inwards, it causes the big toe to be pushed up by ground reaction forces. As the toe is pushed up, it then gets jammed at the first metatarsophalangeal joints and restricts the dorsiflexion of the big toe. So our aim initially is to promote proper foot function. So that is with orthotic devices, improved shoes. We tend to, our aim is to stop the overpronation and thus reducing the flattening of the arch, for a layman term, and allowing the first metatarsal, the big toe joint, the big toe bone, to come down. So as it comes down or plantar flexes, we are then able to dorsiflex the toe in a normally functioning first MTPJ. So how do we achieve that? Obviously, assessment of the patient's foot, assessment of the gait, applying forces to the foot where we'll control it or reduce the overpronation in the best manner depending on the foot type. And those things we'll touch on later on in other videos. But as well as that, you've got to be really careful on where you apply the pressure to the foot. So what we'll talk about now is improving first-rate function. So if a patient comes to me with first MTPJ pain, first thing I look at what's causing it. Is it caused by the fact that the foot is overpronating and it's limiting or jamming that joint, and that is setting up an inflammation response, pain, etc. So we want to control that foot. We want to increase or promote the first-rate function. So how do we do it with orthotics? Well, we've got some examples. Number one, we clearly want to promote subtalar joint or reduce subtalar joint overpronation, promote control around the subtalar joint, which will then keep and allow, like I mentioned, the first MTPJ to come down. But secondly, we need to make sure that we do not place any excess pressure in the orthotic on the distal part of the shell. A device such as a modified route, the way that we do it at Footwork, will actually jam up the first MTPJ. Another way in the past to free up the first MTPJ joint was basically to do a first ray or a first MTPJ cutout in the shell. Now, we have a slight problem with that, although we do offer it as an option on our prescription form. My problem with it is the only place that the first MTPJ or the first MTPJ starts to plantar flex or the first ray starts to plantar flex is at the medial cuneiform first metatarsal joint. So in actual fact, that cutout would have to go all the way back in order to allow for the first metatarsal to plantar flex and then open up the joint. Second problem I have with that is that by cutting the corner out, if you can see it clearly, not sure which plane I can put it at, by cutting that corner out, we actually make the device unstable and we make it rock. So at Footwork, we've come up many years ago with a modification called first tray accommodation, where we literally used to add extra plaster under the first tray, thus allowing that corner of the orthotic to come down and be balanced. So it had two functions. Number one, the shell would be balanced, so therefore it wouldn't rock. But as we added extra plaster from the medial cuneiform under the first metatarsal itself, it allowed the whole first metatarsal to plantar flex rather than be pushed up by the shell. Okay, so that's one way that we can achieve better function in those patients where the first metatarsophalangeal joint pain is caused by poor function. Other things to consider are things such as padding. A lot of times we see where podiatrists will request a pad to offload the first MTPJ, such as a single wing plantar cover. In my opinion, that pad actually makes the thing, mechanically makes it worse, because when the pad starts proximal to the med heads, the area under the first tray actually dorsiflexes the first metatarsal, thus again aiding in the jamming mechanism. So probably the better pad to use would be a 4-foot valgus pad, or otherwise known in here as a plantar cover 2 to 5, or a Moriley pad. Again, for further information on those, we'll talk about in due course, or you can just check our website and our videos. and have a look at it. So that's one way to actually assess first MTPJ pain and make sure that you've got a patient that you want to improve first ray function and thus reduce the symptoms. But what happens if the pain is not caused by the locking mechanism, but the patient's already got first MTPJ osteoarthritic changes because of the continual jamming process which happens? And a lot of athletes in the middle years, 30s, 40s onwards, do experience the type of foot site. So that pain can be caused by the actual osteoarthritic changes and the joint being forced into dorsiflexion or into bending where it doesn't want to go there. In that case, we might have to look at splinting or supporting the joint to restrict the actual movement, because it's the actual movement that's causing the pain. So one basic way to do it is to request a Morton's extension, which is pretty much a splint for the big toe. So what we do there, this is made out of polypropylene, and that stops the foot from bending, or the first metatarsophalangeal joint from bending. Now, it looks that it can be kind of uncomfortable in the foot because the big joint is there and you're trying to bend it, but it actually works really, really well in the right cases. We've actually had AFL players playing seasons in these in their football boots. If you've got an athlete that wants to use that and actually be dynamic and run around with a modification such as this, adding a rocker bottom sole to the shoe of some sorts will actually help it. So we've had cases where we've actually done this type of a modification for pro golfers who couldn't walk 7-8 holes because of pain in the first metatarsophalangeal joint because of osteoarthritic changes. Okay, so what we've done is we've made a first Ray Morton's extension, and then we've actually added a rocker bottom sole to their shoes, or we've put them into shoes with a rocker bottom sole, such as MBT shoes. Oh, sorry, my apologies, Hokas. How could I forget Hokas? Hokas come in a very rocker bottom style, some of the models, and work really well to alleviate first MTPJ pain because it stops you from having to rely on bending of that sole. So again, it's a splinting mechanism with the rocker bottom adding that propulsion mechanism which is required for our normal walking, especially for somebody who wants to be dynamic or an athlete. Otherwise, things to consider is, again, going back to improved function, is to actually force the first ray into plantar flexion. So there's several ways we can do that. Number one is actually adding forefoot valgus posting. This is an example of, showed an example of an extrinsic post because on the video you can see it better, so it can be done extrinsically. So any wedging that we can do laterally to the foot will actually force the mid-tarsal joint to pronate and thus plantar flex the first ray. You need proper support around the subtalar joints in order for that mechanism to be activated. So you can do it extrinsically via forefoot valgus posting. You can also do it intrinsically. So with our software, we can actually modify that shell intrinsically and get the same shape where we do lateral support. And in this case, we've actually got an example here of a stiffer lateral column, which really adds lateral wedging to the device, thus promoting first ray function. And this device has first MTPJ or first ray accommodation. It's not a cutout, it's a first ray accommodation. The shell is nicely balanced. As you can see, it's all on the same plane and thus doesn't rock. So if you have any questions about these or any other modifications that we might do, please feel free to post them up in Messenger on our Facebook site, or send us an email and we'll be happy to answer those. Or if you have any suggestion for further down the track of what you would like us to discuss, or what you would like us to show you and how we do things, we'd be very open to those suggestions as well.